aspire to lead one. But I love sitting around talking about policy, so if I get a chance to do that in front of people, that's even better. But what we really want to do today is explore some common concepts in policy development. We're going to do that through storytelling rather than through PowerPoint presentations. We've got folks here up on stage with some great wide ranges of experience that we're just going to explore some ideas through storytelling, and hopefully you're going to find it as inspirational as I know I'm going to. We are going to have time for questions at the end of the session, and for those of you who have joined via live streaming, you can ask your questions online and Melissa will ask them out loud on your behalf. So I am going to get us started without much further ado. So, my first question. Well, one of the first things I wanted to really find out about is, does it make a difference where the drive or the impetus for your policy comes from? Are there things that you have to do differently depending on, is it me, myself, that's trying to advocate for the policy, or has someone else come to me and said, hey, I want to do this policy, can you help? So we're going to start off with Ellen, who has a great story to tell about a particular policy that she's worked on. And so I'd just love to find out about where the drive from your policy came from and how you work with them.
So we've, can you hear me? We've been working for the last almost 2 years in Ottawa with our municipal childcare on developing a childcare healthy eating and physical activity policy. It started out as a policy, it's now called a guideline, but it is a policy because they are going to be following it. But where it started was they came to us. The childcare, the manager of childcare actually came to us because they were concerned about the food that was being served in the childcare centers, especially the number of birthday cakes that were the huge birthday cakes that, and when you're in a childcare center of up to 50 children, they were almost having birthday cakes every day. And also that there was a lot of inconsistency. There are now there are 13 municipal childcare centers that are run through the city. We have a number of other ones that are community-based that are also subsidized by the city, but there are 13 now that are completely funded by the city of Ottawa. And they were serving different things in every one of the centers. The menus were all inconsistent, and there was a lot of concern not only from the staff, but also from the parents as well, that they were concerned about
being birthday. So that's really where it started.
That's great. So the drive for your policy came from outside of your agency, from outside the public health unit. So Nicole, I was wondering if you have an example from Niagara where the health unit itself was advocating for a policy outside of your own agency.
Can you hear me okay? Okay, so one of the projects that I've been working on for the past year and a half is the Municipal Positive Initiative, which aims to create a healthier food environment and recreation settings. This initiative is really a two-pronged approach, where we are looking at different recreation settings as well as different types of decision makers. So the first is looking at sports leagues, associations, as well as at the coach level, so the team level, and looking at healthy eating policies specifically, and providing resources and supports to those organizations so that it's easier for them to do so. So we've developed a toolkit which includes some healthy eating policy samples,
as well as some letters which coaches can use to communicate policy changes to parents, and which parents can also use to advocate for a team policy for their children. So that's that first kind of prong to the whole initiative. The second, which we've dedicated a lot more in terms of resources and time, is looking at specifically municipally run arenas and the concession stands within those settings. So we started doing a lot of background research to determine what other jurisdictions have done, and we realized that there's a lot of interest across Ontario as well as in the States and across Canada in doing this. But one of the main barriers has really been about the potential loss for revenue. So we've recognized that as a huge challenge. There's a lot of support for healthy eating in this arena setting. A lot of people want to see it happen, but it's that kind of bottom line negative impact that people are really scared for. So we've been working with the municipal arenas. It is the municipality that is the ultimate decision maker. So we're working to now build a strong case to demonstrate the feasibility of actually doing this so that we can hopefully get support later on in the future for municipalities to actually adopt a policy or revise their procurement policies to require healthier options in the concessions. We started off doing some surveys with arena patrons to kind of get a sense of their purchasing habits and their behaviors, looking at what types of foods they currently buy. If they don't purchase foods in the arena, why don't they? Is it because of price, convenience, because there's a lack of healthy options available? We also asked them what type of foods they would like to see. From the results of that survey, we then did some tastings in those settings and said, okay, this is what we've identified through the surveys that you said you wanted to see. Do you actually like it, and how much would you pay for it if we had it in the concession? From that now, we've actually, we're in the phase where we're going to launch a pilot this weekend actually. We've hired some business consultants to really help us develop an implementation plan, which recognizes the different business models of concessions. So there's some concessions that are run by the municipality, others that are run by sports leagues, and then those who are run privately. So we had the business consultants kind of take consideration of those different models and develop a plan so we can try to be as successful as possible. At the end of the pilot phase, we will be doing a full assessment of the sales tracking data and collect feedback from patrons to determine whether or not it is feasible. And obviously we're hopeful that it will be in the end, and we will then take the results to the municipality and hopefully get them to make some policy change.
That's great. So I have a hypothesis that I'm going to have Sarah either agree with or dispute. But it kind of sounds like, just from your two examples, and in Ellen's example, where the drive for the policy came, from the folks who actually wanted to implement this. Please help us develop a policy. So you already had the buy-in, and you were able to work with them to create the policy. But Nicole, in your case, you had to do a lot of selling. And you actually had to do a lot of research. You've hired some consultants, and you already know that you have some barriers. So it kind of sounds like a very different process depending on where the drive for the policy is coming from. So I'm wondering, Sarah, if you found that different approaches are needed depending on where the drive for the policy is coming from, and if you could maybe talk about that.
Sure, certainly. So in terms of the different drives and how that influences policy development in the process, from a land use planner and a land use planner and policy planner, there really are two different drivers that influence land use policy development, and the process is a little bit different from those perspectives where, for instance, from the context of municipalities having to do an update of the official plan, whether it's through an official plan amendment of its own process, or if it's under comprehensive 5-year review process. There are legislated provincial requirements that need to be adhered to, and a lot of municipalities have to do an update of their official plan at least every 5 years to conform to provincial acts or regulations. And with those processes, those policies need to be updated through the Planning Act. And there are specific requirements under the Planning Act that require consultation. There's a prescriptive process that needs to be followed, and there's specific channels where input is required from stakeholders, including public health as well as other agencies as well, including the public. In that instance, if it's an official plan review being undertaken for conformity exercise or to meet a legislative requirement, there are specific complexities that need to be addressed as part of that planning review process. You're looking at a wide range of concerns. It could be related to some of the environmental interests that the town may have. There could be some economic development interests, but at the end of the day, it's a matter of ensuring that there is conformity to the provincial plans that are directing that top-down process. If policy development is being undertaken that is outside of that provincially mandated process, where, for instance, let's say council decided that they want to take on active transportation or a healthy eating initiative, and it's a municipally adopted process, there could be some policy development opportunities out of those specific plans or initiatives as well. But that's certainly reflective of that specific initiative being undertaken. In that specific instance, they have their own process. It could be more cooperative, collaborative, and it may not be as prescriptive as a provincially mandated process. So the opportunities to engage other stakeholders would be more creative. There's opportunities for other groups, whether it's an advocacy group, a community organization, or even public health, to be really proactive and hands-on in helping the municipalities support more innovative policy approaches, because there aren't any legislative requirements that they're bound to as part of that process.
So you can have a little bit of creative license depending on where the drive for the policy is coming from and the types of legislations or the types of frameworks that you have to work within. Is that a fair comment? Okay, great. So, I mean, it really sounds like, and I think anyone who has even imagined doing policy work knows that you really require a lot of support from a lot of different people and groups of people when you're doing policy work. So I thought maybe we could talk a little bit about some of the strategies that each of you have used to gain support from the various people that are going to be implementing the policy, affected by the policy, those who oppose it, and those who are proponents of it. So I'm going to ask Nicole to talk a little bit first about what you do as part of the early stages of policy development to figure out who do you need on board and how do you get them.
For me, the nature of my role is to provide policy support to the Chronic Disease Injury Prevention Division. So that's across the whole division, on different portfolios that can range from healthy eating, physical activity, to alcohol misuse, some seniors falls, concussions in sports, so a large variety of things. So one of the goals that we've set out is to really develop some tools that can be used to monitor and develop a strong understanding of the region. So the municipalities, there's 12 of them. And look at their stance on a variety of different issues. Two of the tools I guess I'll highlight. One of them is the review of municipal council meeting minutes, where we do a scan of all the minutes for a period of 6 months at a time, using a variety of search terms. In this way we can get a sense of who's talking about what and how they're talking about the issue. And also, there is a possibility where you can kind of see some councillors who might be in support of a particular issue, and then others who might be in opposition to it. Having an idea of how a municipality is talking about an issue gives us a good sense of how we have to frame what we're trying to put forward. So that's definitely been a thing that we've used. The second tool was a review of municipal strategic plans. As I said, there's 12 municipalities in Niagara, and most of them have either a strategic plan or a business plan set out for a 4 to 5 year period, where it highlights kind of the key priorities or objectives for that term. I did a review of all of them, identified some key themes that were relevant to some of the work that we do in the division, and essentially created a visual tool that can be used to kind of highlight where municipalities' priorities are aligned with some of the things that we're doing. And both of these tools are really just during the planning phase, when we're looking at potentially moving something forward and we need to have an ask for a municipality or for those decision makers, then we can get a sense of who the first person should be or the first municipality should be. So those are just kind of high level.
So you use those two tools to get a real strong sense of not only what are the plans for the municipality as a whole, but who those individuals on council are and how they feel about various issues. When you talked about doing a review of minutes 6 months at a time, keyword searches, how much work is that? It sounds super daunting to me.
It's very time consuming, but we've been lucky to get students, summer students, and it's a great experience for them. They get exposure to the structure of municipality, how the council works, how it functions, as well as exposure to the different issues across the board.
And is that a strategy that you found is worth the effort? Just having a sense of who is on board with what and what are some of the things that they are passionate about or not? Has it been worth the effort?
We've done 2 rounds. So this past summer we revised the first time that we did it. We changed the tools and the templates a little bit. So we're continuing to revise it so that it is as useful as it can be. It definitely, when we set out to do this project initially, we had thought that if this would identify a clear cut who the opposers are, who are those champions who can bring something forward. It's not that clear cut in the minutes, but it definitely gives a sense of how they're talking about the issue or whether or not they're even talking about it, whether it's on the agenda. So.
And sometimes that gives you as much information as anything else when it's not even on people's minds. Oh, that's really interesting. So, Sarah, I'm wondering if you have anything to build on what Nicole is saying from a sort of a non-public health perspective in terms of how you get support for the policy work that you're wanting to do.
There's actually quite a number of approaches that I've used specifically to gain support, and it's really reflective, I think, of the unique situation or circumstance of that municipality, and certainly not a one-size-fits-all approach works, whether or not you're an urban or rural municipality or small or large. It's a matter of tailoring it to the specific strengths or the unique differentiators and capacities that already exist within that municipality that you're building the policy work for. There are specific principles that really help to build policy development from a land use perspective, and that's really is whether or not the policy is legally defensible from the perspective of the Planning Act, whether it's feasible and applicable to the specific needs of that municipality, and also third, whether or not it's cost effective. I mean, with those 3 principles in place, it really informs the type of approaches that I use in sort of building policy support. So for instance, when you're thinking about policies that are legally defensible, there's certainly policies that fit under the planning framework that we work with. In working with various healthiness and in understanding some of the interests that public health has, there's certainly a lot of opportunities where I've seen of examples being brought forward to the Ontario land use context from elsewhere, but it may not necessarily work because there's certain limitations to our Planning Act that we need to be mindful of, and we have to be working within those confines. The other thing that municipalities also certainly keep in mind as well is the potential implications for the development community in terms of economic development and the long-term viability. You wouldn't want to have any policies that are too restrictive where it's going to deter development away. So it's very important to try to understand the context in which that policy is being applied. Similar to what Nicole talked about, the strategic plan. At the same time, I always look at the municipal strategic plan. What are the goals of council at the time? Are there any other economic development strategies being undertaken, not just by the municipality, but with other organizations, whether it's the chambers of commerce or other boards as well, and try to find similarities there and areas of convergence. In terms of feasibility, we have to identify specifically if these policy outcomes are going to serve the specific opportunities or problems that exist within the community. And the tool that I've been using of late is, for instance, a lot of the work right now that I'm working in is small municipalities of less than 1,200 people. And I've been using what's called a RALA tool, Rural Active Living Assessment Tool, that was developed by Dr. Hartley from the University of Southern Maine. And we've actually, our company has actually modified that tool specifically for small municipalities, where we are able to track all the resources in the town, the infrastructure that supports the capacities of existing organizations, of the existence of policies. And using a framework like this helps us to identify where those policies supports would be and whether or not it helps leverage existing assets within the community. The third thing is cost effectiveness. Some municipalities are large, they have big budgets, and that's great for them if they have a lot of money to work with, but not all municipalities have big budgets. So we want to make sure that the policies that we develop, they can be implementable. There's no sense in developing a policy that no one has the ability to afford in terms of its implementation. So that is the third thing that we're mindful of in terms of identifying that support.
So I'm going to spring a question on you, Sarah. We did not talk about it at the time. But just in your mention of the RALA tool, which sounds fantastic, I'm wondering, in your experience, and I think both Ellen and Nicole as well, I'm wondering if you could just talk a little bit about the differences in working with rural, urban, and sort of mid-sized suburban municipalities or settings. Do you have different approaches? I know that often in smaller centers, there's really one person you need to get to know, whereas in larger centers, of course, it's quite different. So I'm wondering if I could just spring that on you all and get your ideas.
So from my perspective, I've actually had the fortunate experience of working with some very positive small rural municipalities. I find that with smaller municipalities, it can be far easier to get things done. For instance, one of the municipalities that I was working with last year was the town of Calendar, where it was a situation you have somebody who's a planner and also somebody who wears an economic development hat and recreation as well. And somebody with multiple roles really has that understanding of where the synergies lie. And in terms of some of the potential roadblocks or challenges, there wasn't that need to have to sell the idea and explain yourself and try to rationalize the opportunity of introducing policies that support active transportation, and at the same time you can increase your tourism potential and here's your development outcomes. If you have somebody who wears those multiple hats, they can understand that. And from my perspective, it was far easier to get a plan developed, approved by council, and also the implementation move forward as well.
I think one of the key things within Niagara is that there are 12 municipalities, and many of them are very different. It's having a good understanding of the issues that they're facing at that point in time. So if you are going to ask them for something, recognizing some of the challenges that they are experiencing, it definitely helps build that relationship and then kind of move things forward.
Well, most of ours that we're dealing with are within the city, although the city of Ottawa does encompass several rural areas because we've been amalgamated for 15 years now.
We love amalgamation.
No. But what we will encounter as we, the phasing of this project was to then go to the community-based childcare centers and also to the family home-based centers that are also funded and subsidized by our city. So I think that's where we'll see the differences. I think there will be differences in the types of foods that's served and the accessibility to. So then I think we might see differences, but we haven't to this point because we're only dealing with the ones that are within the city.
Right, so we're going to get a little bit back on track. I just had to divert myself there for a moment. So just picking up on that, Ellen, you had a really interesting situation again because you had folks that came to you and said, please develop a policy with us, for us, but there was still a lot of work that you had to do to get everyone on side. So I'm wondering if you can talk about the kinds of things that you had to do to get the support you needed.
I think municipal childcare thought that it was going to be easy. I mean, we knew in public health, we know how much it takes to get, it would have been years for us to even find this champion within municipal childcare that wanted to do this, right? And we didn't have to do that because they came to us. But what we really found was the most effective way for this to happen was we established a working group And within that working group, we had childcare staff. So we had teachers, we had cooks, we had supervisors, and we met every 2 weeks, and we came up with this policy together. Childcare was willing to provide support for those staff to attend these meetings, which is a big deal, right? Because they'd have to get supply, cooks, they'd have to get supply. So we met for a couple of hours every 2 weeks, so that was a huge time commitment on there, but they had that support from management to do that. And also we had, we came up, myself and the manager of childcare came up with a bit of a plan to say, so that we would get commitment both from childcare and also from Ottawa Public Health in terms of commitment to seeing this through. Because I think both parties kind of thought, well, this is an easy thing to do and it'll take no time at all, and once it's done, it's over, bang, we'll go on to something else. But we all know that with this kind of stuff, it takes a long time. So what we did was they actually, we both of us are part of the City of Ottawa, so we're both funded by the Municipal Childcare and Ottawa Public Health, are both within the city. So they seconded my time for 2 days of my 5 days and paid for my salary. And that is for an 18-month term. And I think that that really showed that they were committed, but also that public health was committed, because what often happens when you develop these partnerships, then public health tells me that I need to move on to something else, and therefore it's my time that they want, right? But because they were paying for my time, public health couldn't do that. So I was really committed to it, and that really secured that partnership and really helped us to bring what all that committee work had done to the next level, which was actually piloting it for 6 months and developing the menus and developing the recipes and all the work that went into that. The other piece that childcare supported, which was amazing, was they took one of their cooks at she had a lot of food skills, and a big factor in all of this was getting the food skills up to the level of need to be able to do this menu planning and to do these recipes. But she was also paid by childcare 2 days a week to work on this with me. So that made a huge difference. So not only was there financial commitment, but there was commitment to having those people on board for the long run. And the third piece that was really critical was we incorporated it as part of our Healthy Eating Active Living strategy, which was a 3-year plan that went forward to our Board of Health. And so it's part of our Healthy Eating Active Living strategy. So the deliverables at the end of this will have to go to our Board of Health. So we're accountable for what we're doing. It's on their agenda. They're going to be asking public health and municipal childcare, okay, you said you were going to do this 2 years ago. Where are you? Where are you going? What stage are you at? So we're continually having to report back. We have to evaluate. So I think those 3 pieces really were critical in making sure that this continued to move forward, and it's still continuing. It's not done yet.
So that leads right into my next question, which is, do you remember even approximately when the child care folks first came to you and said, hey, we want to do this policy? How long ago was that?
It will be 2 years in January.
And the policy is in pilot testing?
We're done with the pilot, which lasted for 6 months, and we're now starting to roll it out in all the municipal centers this fall.
Okay, so one of the reasons why I wanted to just sort of pull that out is I know that a lot of the time when anyone is working on policy, sometimes it just feels like it takes a long time. There's a lot of patience that's required. And one of the things I just wanted to pull out of that is, in this case, there was readiness. People wanted to do it. Let's do it. And you've made significant progress, but you're 2 years in.
Mm-hmm.
So I think it just serves to illustrate, just to remind us, yeah, it can take a long time, even with, and you have massive support. I mean, seconding people and accountable, I mean, that's amazing. And it's just a long process. Does anyone else want to jump in on that and share some thoughts, right? Because we've got lots of time.
So I guess with regards to the process, I empathize as well. Policy development can't happen overnight. It takes time to build support. And with regards to municipal policy, like in some situations, we've had to introduce a specific amendment first to introduce some of the higher level objectives. And in particular, this is something that I had done when working with the municipality of Chatham-Kent, for instance, a couple of years ago, when they were looking at the 6 priority areas and then trying to find some of the policy opportunities in the official plan around the 6. And it was actually a 3-step process in that regard, where we did an initial gap analysis of the policies that could be introduced and where examples and standards lie elsewhere to inform that work. And that was basically back in 2010. 2011, or maybe towards the end of 2011, that was basically followed up with a very specific active and healthy municipal policy amendment that only supports the amendment of the higher level objectives related to physical activity and healthy eating. But that was important because it establishes the council and the municipality's support for these policy objectives, for the commitment for future detailed policy development, which is what we're now doing through the detailed 5-year comprehensive review. At that time, they may not have been ready yet for some of the detailed policies, but now a lot of those details are being introduced as part of the official 5-year review process. So it does take time. It's not something that can happen overnight.
So you really have to go step by step with that, and you talked about really, laying the groundwork for future work. So if you were to go back 5 years in time, did you have a really solid sense of the step by step of where you wanted to go? Did you have that sort of planned out? Okay, we're going to do it incrementally. We're going to start to build. Do you know what I'm saying? Was it planned? Was it fortuitous?
It was a happy accident. So the lesson there was that policy development is it's more feasible if it's done in small increments, and that's something that we've heard from various sessions over the last day and a half or so. But it was a happy, fortunate accident. And the other thing that happened with that as well is we did this health and all policies approach, which helps to provide some support in integrating health decisions for the various departments and for the municipality as a whole. So that was the behind-the-scenes piece that was undertaken as well to help further along the support.
Okay, great.
Can I just jump in and add that I think it's happy accidents wonderful, but I think it's seizing the opportunities, and also it's having champions. It was just so huge for us, not only at the higher levels, but at the ground level. If we didn't have those people that were willing to put all that time and effort into building this, they really wanted to see it work, but they were willing to put the time and effort in and to continue with it, and without that, it wouldn't have happened either.
That's a really great point. So I know we want to come back to Nicole, but we do have a question from the audience, and I'm going to ask you to go up to the mic just so that Brian can hear you. The audience, wow, I really do feel like
Hi, my name is Naomi. I'm a public health nurse from Minnesota. And my question was around, you were talking about introducing amendments. So were you talking about amendments to the official plan?
Yes.
Okay. So, and can that be done at any time? Can someone just sort of propose, because you were saying that there's also a prescribed process for doing the official plan. So can someone just sort of do an application to council and say, we propose you amend the official plan in this way?
It really has to be strategic. Not anyone can just come forward, because with that particular amendment that came before the comprehensive 5-year period, it was also to incorporate some of the policies that were proposed as part of other strategic council adopted plans as well. So for about, I guess, 2 years before the amendment happened, they did recreation plan, they did another transportation plan, and they also did a housing plan. But when they did those plans, part of that plan included policy recommendations. So those policy recommendations were never brought forward yet. So it was a decision to pretty much bring them all together as one, and they serve a common theme of supporting healthy communities. It certainly is different depending on the context. I mean, some municipalities have an MMH representative, and in some cases the municipality would need to liaise with that representative in terms of bringing forward an amendment process. In other cases, if there are minor amendments to specific areas within the municipality, they can be brought forward. A lot of the time, you know, when it comes to proposing amendments, it costs resources, it costs staff time, and this is something that municipalities need to be mindful of. Do they have the resource to keep bringing back amendments, or would they want to bundle it together?
So you really do have to have that strategic long-term sort of vision, but also be open to those happy accidents. So being aware of what's happening currently, but with your eye on the prize, as it were, down the road. So Nicole, to be honest, I've kind of lost track of what question we're talking about, but I bet you have things to say.
Just one comment. I mean, policy can definitely seem daunting at times. Things can take a really long time to happen. One activity that we kind of do within our division is tracking progression, and that's been helpful for us. We have kind of a template that we follow, so we can kind of, you know, demonstrate progress. We can look back and we can see, you know, we've sent out letters of support at this period of time, and we've developed this relationship, and you can kind of just see all of the work that you do, because sometimes it seems like, you know, we haven't really gone anywhere, but there's been a lot of resources that have gone into something. So that's one thing that we do that helps kind of keep everything in focus.
And I'd imagine that would be really helpful for keeping your community partners motivated. Because one of the things is that we hear a lot from folks who are working in coalitions and partnerships at the community level is how difficult it is to get everyone on board and keep their interest maintained when you're doing policy work, when sometimes you don't see the results for 2 years, 10 years, and sometimes even longer. So can you maybe talk a little bit about how you use, again, I'm just bringing questions on you, do you use that tool in that way to help show community members or folks who are involved, maybe more the periphery of that policy work? Yes, this is what we're doing.
Definitely with Healthy Living Niagara and some of the work groups, we share that kind of as part of a work plan with them. It's more of kind of a working internal document as of right now. And it's kind of, it houses all links to documents that have been produced in support of specific policy. So it's really just a one-stop document where you have a collection of everything that has been done. It's easy access that if you need to recall a document and share it, you can kind of go into that and recall all that information and then share that information to community partners. But it's definitely more of an internal thing.
That sounds like a really useful tool. So I'm just going to pause us up here on the podium for just a second because we have 35 minutes actually left, which seems like lots of time. I do have 2 more questions that I want our amazing panelists to talk about, but before we do that, I thought I would open it up to our lovely audience. See if you have any questions about anything that's been talked about so far or any other thoughts you have. And if you could just use the mics so that Brian can hear you. Any questions from the internet, Melissa? Okay, hi, internet folks, ask us your questions.
So, did you ever come across like unexpected support or unexpected partners that you wouldn't imagine as being a part of this whole process but just happened to be at some point? So just wondering.
That's a great question.
Unexpected.
Wouldn't be that usual one, but the one more expected from the beginning.
Yeah. I'm sure we did. We haven't left. I think, you know, I'm not even going to turn that around, and I think I had visions of partners or supporters of what I was working on that didn't turn out to be that way.
Okay, and that's,
I can see it that way. I'm not sure that because they came to us and because they were so willing to provide that input. But I can say, and I don't know, I'm on tape here, but from public health's perspective, and I wanted to jump in when she was talking to, because they kind of wanted to see us at the end way faster than, and if I had been tracking and we had been tracking better, because we had so many steps along the way, but so many things that happened that changed that process. that I could have shown them, well, you know what, we're not there yet. They kept asking, when are you implementing, and when are you done, and when you know, we can move on. But I think that was more of a surprise for me, was that they were trying to push that along because they wanted us to be finished. They wanted to see that deliverable at the end, because I don't think they really understood the amount of work and effort that was going into it. Yeah, that was a bit unexpected.
I guess from my perspective, one situation where to me was unexpected with regards to a policy that talks about whether or not active transportation is utilitarian versus recreation, and the premise of that was based on the funding where it comes from, where if it was a trail that supports recreation, if you classify active transportation to support just recreation and physical activity, it's funding that would be coming out of maybe recreation department or an external AT committee or another funding source. Whereas if it's an on-road sort of active transportation facility where the intent is to support travel and utilitarian purposes, then the funding would be coming from Public Works. And there was a whole series of discussions, well, how do you classify it, how do you define it, and it's something that benefits everyone. You can't just classify it as one and not the other. And there was a whole, there was a sense of, I guess, well, not mediation, but rationale, as well as discussion that needed to be done with all the groups involved to make sure that it is fair for everyone, so that way the money is being divided up accordingly and it's being allocated accordingly. And that was something that I would expect to be emerging out of a policy development. But that's, again, going back to the understanding that you need to understand the cost implications of the policies that you propose.
I think within our health unit, one thing that we do really well is recognizing when we don't necessarily have the skill set to do something, and really trying to engage different sectors to try to help support the work that we're doing. So, for example, the Fueling Healthy Bodies work, we didn't have, the business mind, marketing type skill set. So we tapped into that kind of industry to provide guidance in the work that we're doing. So we try hard to kind of recognize what our limits are so that we can really well-informed work and build relationships beyond just health.
Okay, question, Abby.
I'm not sure whether this is sort of a silly question, but I'd like each of you to define policy. And see if you can come up with a consensus as to what policy is.
To me, at a much higher level, policy is anything that a government or an organization chooses to do or not to do. So high level, it can be anything. It's making a conscious decision, recognizing that there's an issue about something, and creating a plan of action to address it. And it might be developing a program, it might be, developing a bylaw. It could be a variety of different tools, because those are all instruments.
It's interesting that you asked that, because we had similar discussions, because we started out that these were going to be our healthy eating, this was going to be the healthy eating policy. But then childcare was told, or I don't know who told them, but we were told by them that they couldn't make it a policy, they had to make it guidelines. And so then we had to, because when we told the childcare staff that, does that mean that we don't have to do it? So I think originally we were starting out as calling it policy because they wanted to mandate it, that it was like a directive, that all of these childcare centers would be following the same guidelines, the same menus, the same, whereas when it changed to being a guideline, that made it a bit softer. But it didn't. In their eyes, it was still going to be mandated, but they couldn't call it a policy because I guess that required council approval, or I don't know, something like this. Because they're in the community and social services and we're in public health. So we have a board of health, but they don't have a board. They they have community and social services, so they would require council approval if it was a policy. But if we just made it a guideline. So it was an interpretation, but it was interesting how the staff interpreted that, because they get policy directives all the time, right, about food safety and about immunization and within the childcare setting, definitely. So they were seeing it differently. We assumed when we started out that we were doing it as policy, which meant you all have to follow by the same rules.
From a land use perspective, policy really is meant to be broader sort of statements that guide intent or commitment of the municipality. It's not necessarily enforced, but it guides potentially enforceable, I guess, tools that are really the zoning bylaws. Mm-hmm. So in the terms of working from a land use plan perspective and working with public health, these are just some of the things that we have to reconcile. Like, what does policy mean for public health versus planning? Because they're quite different. Under planning, we have to develop policies that are consistent with and that conform to provincial statements. And the provincial statements are statements. They're called statements in the PPS, as well as any sort of standards from other provincial acts. But the policies are meant to be flexible, but they can also be they also need to be clear as well, because oftentimes there's a lot of misinterpretation in terms of how that policy is being applied. But I think a lot of municipalities nowadays, especially the larger ones, they are working closer together with other stakeholders within public health. And just for instance, one of the projects that I'm doing is doing a parks and open space plan, and it's the first time I've heard from a municipal department saying we need to have public health perspective to help us identify the economic valuation or the economic benefits, so we can push these policies along. So the policies guide the intent, and the support is needed from others.
I think it's a really great thank you. It's a really great question. Because I think just the answers we have from our three folks up here illustrate that policy does mean different things to different people. And one of the things that I personally recommend is when you start throwing the P word, as I call it, around, especially when you're working in community groups with community partners, it's sometimes really helpful to get a common understanding. When you say this word, what does it mean to you? Because this is what it means when I say it. And I'm just going to end my little spiel here by sharing my personal favorite definition of policy, which many of you have likely heard, and in all likelihood I stole it from Nancy Dubois, which is policy is like sausage. Nobody knows what's in it, and no one wants to see how it's made.
I've never heard that before.
Yeah, Google it. It's by unknown. We have another question, but we also have an online question, which I'm pretty excited about. And there's a mic right behind you, Melissa.
Well, I'm thinking because the live streaming mic, everybody can hear me, right?
Brian, can you hear?
Yeah. No? Okay. So it's a two-part question from Heather on live streaming. So do you think leadership needs to come from grassroots or public health units? So that's the first part of the question. And then the second part of the question was, how can partnerships be encouraged in order to build healthy local communities?
Okay, so the first part was kind of the grassroots, or kind of the bottom up, versus public health, or sort of the top down. And then the second part is, how can we get folks together to do it? Okay. Everyone looks at
I think it can come from either direction. It just really depends on what what political support there is, what readiness. Sometimes it's even nice to try both approaches, building those relationships at the local level, and then also, working within the health unit to push something forward.
Yeah, I think it can come from both places, and also it really depends on, again, the unique situation of the community, because I've even had other regional or regional governments that I've worked with, where they said that they needed the assistance of some advocacy groups to help push policies forward, because there could be limitations on behalf of municipal government where they may not have the ability, but if they can have the assistance of an organization to help communicate that need, to advocate for some of the changes and to provide support, this is something that can certainly help them. With regards to community groups and others, with some of the smaller municipalities, I think it really depends on where the funding is coming from and who's paying the bills, because that makes a big difference. Because some of the smaller municipalities I work with, they may not have the resources internally or the tax base to help push along some of these actions or policy development, but the community partners or other organizations may have, and they depend more on these other parts. And this is really where some of the opportunities can come together. So looking at who has the skill set, who has the capacity, as well as the opportunity, and finding ways for all parties to work together that way.
I think too, sometimes it's not only about leadership, but it's where the idea comes from, and I think it's a recognition of that those grassroots have great ideas, but they don't always have the capacity for that leadership. But then they turn to people in public health or other organizations for the leadership, because we may not have the funding or the capacity, but we definitely have the mandate to lead these things. And it is a give and take, because often they have the great ideas. Sometimes we have the great ideas too, but we can't get them on board. But in more cases than not, I think the ideas and the juice comes from the grassroots, but it's our ability to move things forward, maybe, that comes from public health or whoever that is.
Yeah, I think it sounds like, and from my experiences too, it really isn't an either or. I think it really depends on too many things to even count. But to start off with, it depends on the type of policy, the area of policy you're working in, the amount of support you have, either the health unit or within the grassroots. And as I think it was Nicole mentioned, there really is not ever a one-size-fits-all approach, really, to anything, but really in policy in general. I think it's having a sense of where the support is, and working with that is really important. So the second part of that question was around working in partnership. That's another great big question.
So relationship development is really important. It has to happen early, and I think even using that as an opportunity to plant the seed before any big undertaking is happening. Because I guess from a planner's perspective, being a planner myself, I find that sometimes, I know I'm okay, planners, they can be some of the most difficult people to work with when it comes to following legislation or being confined to the specific rules or the bureaucracies that they have to work with. But if you have that opportunity to at least start the conversation, engage in dialogue with public health, with your community, with stakeholders, and even especially other departments like engineering and recreation, it's really important to start that process and then to build that relationship and trust before implementation or before any sort of initiative gets underway.
Anything to that? Communication is critical, and I see that especially because in the city of Ottawa, being a huge organization, that community and social services, where childcare sits under, and public health, that we've been able to, and we see that with Parks and Rec, we see that with planning and transportation. It's communicating, and it's building those bridges and developing those partnerships right there before you even dream of building partnerships with the groups in the community. Because often what happens is somebody in one arm of the city has no idea what somebody in another arm is doing, and most of the time it's just really bad communication, and that's really a big problem I find in a big organization. And if you can rectify that somehow by opening doors and then being invited or asking to be invited to meetings or sit on committees or sit on work groups, that they may not think that public health has a role that's getting better, I think, but for a long time we're so siloed and it's communicating across those.
I don't really have much to add, just that I'm lucky in our health unit that I work with amazing people who are good at engaging and building relationships. I can't take credit for that piece, but they definitely have always, they are monitoring things and looking for any opportunity where they can actually, come in and have public health at that table.
That's great, and thanks for the great online question, Helen, I think it was. Okay, we've got another question from our wonderful audience.
Nicole had talked about scanning the council minutes for looking for opportunities, and Sari mentioned about health and all policy. And I was curious to ask about the benefits and advantages of perhaps scanning existing policy and business plans, looking for opportunities to apply that health and all policy lens, rather than an amend versus creating new. And is it a shortcut? Are there advantages in doing that? The benefits? And is it an area of opportunity that we should be looking for rather than starting at step one?
So the health and policies approach, it was more from the perspective of thinking about how health considerations can be embedded in existing processes. And it's not to create a whole new structure. It's quite costly and timely to do that. But part of that is understanding what the departmental objectives are, what the mandates are, and I think there's not a lot of opportunity to try to introduce that with the resources that already exist. And it's really looking at those existing assets and the skill sets and what's currently within each of the departments. Because right now, a lot of municipalities, they do have strategic plans. They have other plans that help move the organization as a whole towards a common objective. The business plans provide that roadmap for each of the departments, but I think within them, if there's any opportunity to embed health considerations as part of those specific processes, then it can only strengthen the collective goals or strategic priorities of council and the administration as a whole. So I think certainly looking at business plans, looking at the resources, especially before operational budgets are being done, and finding ways of helping to develop synergy. With the specific example of where I was introducing the health policies in CK was that, if anybody knows Karen Lodi, she was actually in corporate services, and I think she's even still there right now, just helping to work with council, with corporate services department, as well as some of the other departments in terms of looking at it and integrating it from a health perspective.
I think when we are doing, scanning municipal minutes or doing a strategic plan review, one of the things that we tend to do is have a broader scope in terms of search terms. We don't stick to, your common terms that are common, at least to the health unit. So for example, if a municipality is looking at, or they're committed to waterfront revitalization, as an example, how can we work some of the work that we're doing and align it with that? If we know that they're working to revitalize that property, is there opportunities for us to then have some active transportation pieces as part of that? So trying to stretch some of the terms and thinking broader and being kind of innovative and creative and trying to kind of transfer some of the health-related pieces into non-health issues.
Because when you think about it, or maybe you guys can think of something, but I tried to do this a little while ago, I couldn't think of something that did not impact health. Practically everything that we do, everything that we operate in, everything in our environment, whether it is health or not health, impacts health. And that's one of the things that I love about the health and all policies approach and health impact assessment, which is all very synergistic, and what you're talking about, Nicole, is really looking at everything that's coming through. How do we look at that from a health lens? How is it really going to affect the health of the communities around us? And I think that often, not always, but often can give us a way in and help us sell a little bit.
And also, don't be afraid of looking at the link between health and sustainability. So many municipalities are doing integrated community sustainability plans, sustainable guidelines, sustainable standards, green development practices. Even though they're all very much into sustainable development when it comes to reducing greenhouse gas or water or energy efficiency, there's a lot of synergy between sustainability and health, and even social sustainability as well. For instance, some of my work out in Alberta was very specific to social sustainability, but what they call social sustainability planning out there is basically what we're doing right now in terms of health planning. But a lot of municipalities, since they're already tapping into ICSP sustainability work, try to find that as an opportunity to help enhance the work that you're doing in health. And I just remembered, in terms of your question and in your response about looking at policies, don't forget also to look at Ontario Municipal Board cases as well, and policy precedents, because any sort of policies that perhaps may be vague or could be challenged by developers, it's always good to try to look into that to see if there's a potential conflict or potential for litigation. Because there's a lot of official plans right now that they may be stepping beyond the limits of what an official plan can do in terms of prescribing prohibited land uses or controlling access for unhealthy foods, but legally it's not defensible in an official plan, and you have to think about some of the potential issues when it comes to some of these other more innovative policies that could work elsewhere, but in Ontario may not necessarily work. So look it up with the Ontario Municipal Board.
No shortage of places to look. So I'm going to move on to kind of a wrap-up question, and that is one critical thing that each of you have learned as a result of the work that you have been doing that you would offer to our audience today as advice for moving forward. Just a little question.
I've kind of alluded to it in almost all of my responses. Just having a good sense of the different perspectives, the different stakeholders who are involved. You might think that a healthy eating policy, for example, just makes sense. It means only one thing to someone, but using Fueling Healthy Bodies initiative as an example, you have, the bottom line, you have potential loss of revenue, which could negatively impact concession owners and operators. So you have to be cognizant of those other things that are at play before you try to develop your action plan.
I had two things. My first one was input from the stakeholders from day one. And for us, it was that working group and piloting it within 4 of the centers for 6 months. And really listening to, they really had a lot of issues with what we were trying to do. And we really had to listen to them, because if we wanted this to work, we had to take what they were telling us and really make it work for them, because we were trying to tell them to change a lot of things in this little child care. And when these cooks had none of those skills, and they didn't know what they thought we were coming out of Mars, right? And so we really had to give and take and really listen to their point of view. The other thing was recognize and appreciate your own limitations, because I think you go into these things thinking, oh, we can do all this and we can do so much and it's going to be perfect, and they're just, you really have to stand back after you've been in it for a while and say, you know what, we really have made significant progress, but it's now nowhere near or nowhere what I thought it was going to be. And just really appreciate what you've done, and not to be too hard on yourself, because I think we often look at what we've done as being, because we didn't get there when we thought we were supposed to get there, or somebody above you was saying, why aren't you there yet? But you have to recognize your own limitations when you're working in a partnership environment.
I've got two things as well. So one is that municipalities, they need to conform with provincial legislation and provincial acts, and In some cases, if there's some vagueness or non-existent policies, it could be the ammunition they need to just say, well, we don't have to because it's not identified. Provincial legislation right now related to planning matters, it's all being updated between now and 2016 for a variety of things, whether it's PPS or Provincial Planning Act, Green Belt Plan, and Energy Act. So just keep in mind that if there's opportunities to provide input, try to do so at the provincial level because that can influence some of the top directives that municipalities need to comply with. The other thing is in terms of recognizing the local municipal strengths and asset use, that is an opportunity as much as possible to help drive policy development and implementation to better improve the community's existing situation. So for instance, I was just up in Mattawa a few weeks ago, and it's a very beautiful community, small town. There's already a strong walkability component downtown, but some of the opportunities that can be put forward in that municipality is to help introduce regional cycling plan that would help support economic development. So try to find the existing strengths of the community and use that as a rallying point, which can be well supported by stakeholders, council, and the public as well.
Well, that is great advice. And this has been fantastic. We've gone on longer than Oprah usually does, and we didn't have any commercial breaks. And I feel like we got a lot for the free car. Yeah, I'm sorry, I'm not giving away cars. No, not today. Maybe at our next conference in 2015, to say. But thank you so much. Such really great perspectives. I love the conversation. Thank you for your questions and our online questions as well. Just in terms of wrapping up, just a reminder of our wonderful flip chart evaluation, which is on the middle doors. So if you wouldn't mind popping a little sticker on there on your way out. Do we know where the stickers are? We'll find it. We'll stand someone at the door and not let you leave until you put your sticker on the paper. And a reminder that the full big formal evaluation paper is in your packages, and there is a chance for you to fill out a little something about each of the workshops, so we highly encourage you to do that. And in particular, I'd love to know how you felt about this format, since it's been long desired and finally I got to realize it today, so I'd love to know how you all thought about that. We do start up again at 2:30. I believe there is more food outside, which you're still hungry. So thank you again to our amazing panelists. Thank you to you, and we'll see you back in here at 2:30. Thanks, everyone.